First of all, I want to point out that a lot of the work I'm going to show, it was done in Dr. Charlie Staples' lab at the University of Florida, the late Dr. Staples, and Marco Sonobi was one of his grad students and was very involved in a lot of these studies. So I think you're going to see actually a lot of similarities. So Pete's talk that he just gave, he was really talking about potential impacts of choline at conception and early embryonic development. And now we're going to talk about supplementing choline at the very end of gestation, very similar to the talk that Eric gave earlier. Let's talk about prenatal choline supplementation and its role in calf performance. So this is data from the last NOM survey that was done in 2014, looking at current practices of raising pre-weaned dairy heifers. And overall, we're doing a good job. You can see here time to first feeding of colostrum and amount of colostrum fed in the first 24 hours. And calves with greater than 10 grams per liter serum IgGs, we're at 87% there. There's still 5% mortality that we saw there, and a lot of morbidity if we really look at that. So why do we focus on calf performance? Because that pre-weaned calf morbidity rate in heifers is still about 34%. So the effects of poor calf performance due to disease during that pre-weaning period, they can have long-term negative effects on these heifers as they go through life and lactation. So what effects can nutritional programming have? So Dr. Hansen showed some data similar to this. So intake of choline by gestating rats and the impact on their offspring. So if we look during pregnancy and lactation, so the impact of lipotropic compounds, whether they're deficient, marginal, moderate, or adequate. So this was a study looking at deficiencies of lipotropes. So in this case, choline, methionine, and vitamin B12 in the diets of rat dams. And what impacts it had on survival of their offspring post-injection. So the rat offspring were injected with Salmonella typhimurium at 100 days of age. So you can see what impacts this lipotrope deficiency in the dams had on the health of these rat pups that were born. So the dams that were deficient in lipotropes, there was 100% mortality in those rat pups after that Salmonella injection. If they were marginal dietary status during gestation and lactation, 90%, and all the way down to a 25% mortality rate post-injection if the dam was adequate in lipotropes during gestation and lactation. So a lot of good data out there looking at that. If we look at choline deficiency in baby calves, so I'll be honest, there's not a lot of choline work in calves. Most of this work was done back in the 1950s, I believe. So even if you look at the most recent NASM publication that came out in December, it's referencing this choline work in calves from 1951. But the signs of choline deficiency in a calf would be labored or rapid breathing, weakness, inability to rise, and anorexia within 4 days in these newborn dairy calves. And they were fed a choline-free synthetic milk. So So all milk replacers in the U.S., they're supplemented with choline, and you'll find choline metabolites in occurring in the milk of cows. So I'm going to reference really through the rest of this presentation 2 cow-calf experiments that were done at the University of Florida. In both of these experiments, the dams were supplemented with rumen-protected choline, so our ReaShure product, at 60 grams per cow per day, so the recommended feeding rate of ReaShure. And ReaShure was fed only during the transition period. So the supplementation started about 21 days pre-calving through 21 days post-calving. The impacts on the dams, those papers have been published in the Journal of Dairy Science. So this first study that was done at the University of Florida was published in 2018, Zenobi et al. And the second study was published in 2020, Baladi et al. And then the second study that was done, the one that was published in 2020, there are some sister publications that actually are in review right now by Zenobi et al. That I'll be referring to. So just a reminder, as far as the impacts of ReaShure on these dams that are being supplemented with ReaShure during the transition period. So this is from that Zenobi paper that was published in 2018. So remember, ReaShure was only supplemented 3 weeks pre-calving to 3 weeks post-calving. They monitored individual feed intakes and milk production, actually out through 15 weeks in lactation. And there was a significant improvement in energy-corrected milk yield over that 15-week period. So a 4.9 pound increase in energy-corrected milk yield over the first 15 weeks of lactation. Now what we had never actually measured before was the carryover effect throughout lactation. If we increase peak milk yield, will that carry through lactation? And it did in this study. So they actually monitored these cows out through 40 weeks of lactation. And there was a 4.6 pound milk response to these ReaShure supplemented dams that carried throughout lactation. The second study that I showed you earlier, the Wambalati study that was published in 2020, they saw similar effects, again, out through 15 weeks of lactation. And there was, again, a 4.9 pound increase in energy-corrected milk in these ReaShure supplemented cows during transition. So prior to these studies, we had received some anecdotal reports from the field about improved calf performance in these in cows that were being supplemented with ReaShure. We had really never looked at that in a controlled research study. So this is actually this is in the 2018 Zenobi publication that's in the Journal of Dairy Science. So this is looking at the effects of prepartum feeding of ReaShure to dams on the growth of their replacement heifers. So the F1 generation, as Dr. Laporta was referring to it in her presentation. So this is really looking at an in utero effect because the calves are basically treated the same once they were born. The colostrum wasn't really separated. There was a pooling of colostrum in this study. So if you look at these heifer calves that were born during that study, so half of these dams were not supplemented with ReaShure during transition. The other half were. So at birth, actually the calves that were born to the ReaShure supplemented dams, those heifer calves, were actually lighter at birth. Some of that was due to twinning. There were more twins that were born to these ReaShure supplemented dams. Obviously, that has nothing to do with the ReaShure. They're only supplemented the last 3 weeks of gestation. By 2 months of age, the heifer weights were the same at weaning. At 12 months of age, there was a significant improvement in body weight in these heifers that were born to the choline supplemented dams. So from birth through 12 months of age, they actually gained about 1/10 of a pound more in average daily gain. These heifer calves were treated the same once they were born. And that carried through actually to calving, to their first calving. So that their post-calving body weights, that difference was even more magnified. Almost an 80-pound difference in post-calving body weight in these heifer calves that were born to the ReaShure supplemented dams. So this is actually looking at, this graph is showing the body weight of this F1 generation. So these heifer calves that were born to the ReaShure supplemented dams, this is tracking their body weight through their first lactation then. So Jimena, similar to some of the data you were showing from the heat stress dams during late lactation. So you can see at calving, these heifers that were born to the ReaShure supplemented dams, they weighed significantly more at calving, and really their body weights were higher out through about 20 weeks or so into lactation. So are there lifelong impacts of receiving these choline biomolecules in utero? I think I hit a slide there. We'll see it later. So prenatal choline supplementation improved health and growth of neonatal Holstein calves. So this is from the second studies that were done at the University of Florida. These are actually in press right now. So this is looking at the impacts of ReaShure supplementation during late gestation, the impacts on the heifer calves that were born to these cows. So this particular experiment, this part of the experiment was designed specifically to look at, first of all, could we repeat what we saw in that first Zenobi trial from 2018? Could we replicate those improved growth rates in the heifer calves that were born? And secondly, we wanted to tease out, is this an in utero effect that's happening the last 3 weeks of gestation, or is it a colostral effect from the colostrum from these dams that are supplemented the last 3 weeks, or is it a combination of the two? So this was the trial design. So half of these dams, 3 weeks before calving, did not receive supplemental choline, and half the dams received ReaShure. So that's looking at whether or not there's an in utero effect. And then there were 2 pools of colostrum that were set up. So there was a pool of non-ReaShure supplemented colostrum and a pool of ReaShure supplemented colostrum. So the heifer calves that were born in this study, so half of these heifers from the control dams received the control colostrum, the non-ReaShure supplemented colostrum. And the other half received colostrum from ReaShure supplemented dams. Same was true the heifer calves that were born to these cows that received ReaShure the last 3 weeks of gestation. So again, half of those heifer calves received control colostrum, half received colostrum from ReaShure supplemented dams. So the results, and so most of the results were in utero effects. They were not colostral effects in the study. So again, looking specifically at the heifer calves that were born. So this is looking at, first of all, at dry matter intake from milk replacer. So you can see there was a significant improvement in milk replacer intake in these heifer calves that were born to dams that were supplemented with ReaShure. And the same thing was true of calf starter intake, higher calf starter intake. In these heifer calves that were born to the dams that received ReaShure in utero. If we look at the incidence of fever in the heifer calves, there was a lower incidence of fever in these heifer calves that were exposed to the choline biomolecules in utero. And then if you look at the concentration of red and white blood cells, so there's a higher concentration of red blood cells in these calves that were exposed to the ReaShure biomolecules in utero, and the same was true if we looked at leukocyte counts. If we look at the growth of these heifers, again, this is an in utero effect that we saw here. So no difference in body weight at birth. At weaning at 56 days of age, no difference in body weight. At 300 days of age, there was a significant increase in body weight in these heifer calves that were exposed to the choline biomolecules in utero. Very similar to the response that we had seen in the earlier study, about 1/10 of a pound difference in average daily gain. This is a survival curve actually looking at calves that had adequate calf starter intake as they approached weaning. So these calves, they were weaned at 56 days, the last 7 days. Before that, they reduced the amount of a milk replacer that was fed. They cut it in half. So you can see 3 of the 4 treatments. Those heifer calves had adequate calf starter intake by the day of weaning. There's this one outlier treatment here. So that solid blue line, those were the calves that did not receive the choline biomolecules in utero or colostrum from the ReaShure supplemented dams, the NN treatment. So we've got this one outlier treatment here. The second paper that's in review right now, this is looking specifically at the bull calves that were born to the dams during this study. So the treatments again were the same as I showed you earlier. Half the dams received a control diet during the transition period, half received ReaShure during transition, and again, there were the 2 pooled colostrum sources that were fed. So if you look at the bull calf effects, so these bulls, they were given an LPS challenge at 21 days of age. So this is showing the rectal temperature response to the LPS challenge to these bull calves. Again, an in utero effect here. So if we look at If we look at rectal temperatures right after the LPS challenge, so this is hours after the LPS challenge, there was a significant in utero effect here with lower rectal temps in these bull calves that were born to the ReaShure supplemented dams. This graph shows respiration and heart rate. So if we look at respiration here, again, this is an in utero effect. So one of the major target organs when you administer LPS to these calves is the lungs. So you can see a lower respiratory rate in breaths per minute in these bull calves that were born to the ReaShure supplemented dams. This is looking at acute phase protein, so plasma haptoglobin levels after the LPS challenge again. And you can see a significantly lower level of haptoglobin in these bull calves that were born to the ReaShure supplemented dams after the LPS challenge. And this is looking at dry matter intake. So there's greater dry matter intake after the LPS challenge in the bulls that were born to those ReaShure supplemented dams again. So you can see prior to the LPS challenge, so the first 21 days of life, the dry matter intake was equal between these two groups of bull calves. But once the LPS challenge was given, the bull calves that were born to the ReaShure supplemented dams had higher dry matter intakes. They were handling this LPS challenge better. And then this shows the body weight differences then. So at birth, so no difference in body weight at birth. There's no difference in body weight at 21 days when the LPS challenge was given. But if we looked at 2 weeks post LPS challenge, these bull calves that were born to the ReaShure supplemented dams had significantly higher body weights. So this is probably the most dramatic graph here. This is actual survival curves from that experiment. This is taking all of the bull and heifer calves into account. So there are 4 treatments here. So this NN treatment, those are the calves that were born to the control dams, so that they weren't supplemented with ReaShure, and they received the control colostrum. So they weren't getting the extra choline biomolecules through the colostrum. The NC, so that's the blue line with the open circles. Those were the calves that were born to non-ReaShure supplemented cows, but they received colostrum from the ReaShure supplemented dams. The CN, those dams received ReaShure during transition, but they were fed the control colostrum. And then the CC, which is this top hash line here, the CC was the treatment that the calves born to ReaShure supplemented dams, and they received colostrum from ReaShure supplemented cows. So you can see the survival curves here. So this is out through 24 days of age. Again, that's because of the LPS challenge that took place in the bull calves. There was no death loss. So there were 25 calves born, no death loss in that CC treatment. The 2 treatments in the middle, so either receiving the choline biomolecules through the colostrum here or receiving it in utero, they were moderate as far as survival. out through 24 days of age. And again, there's this outlier treatment here again, the NN, where these calves never received the choline, the extra choline biomolecules, either in utero or through the colostrum. There was a 30% death loss in those calves. There was no intentional health challenge that was given here other than the LPS challenge, but there was an issue in the herd as far as calf health, and it was sort of exacerbated here. So you can see that these calves that were exposed to the choline biomolecules had a much better health status and survivability. So we have been able to replicate this improved average daily gain in the Holstein calves that were born from dams fed ReaShure. So again, this 2018 study that was published in the Journal of Dairy Science. So that's again, these are average daily gains from birth through 50 weeks of age in the heifer calves that were born. So almost 1/10 of a pound improvement in average daily gain. That was replicated again in the study that's in review right now in the heifer calves. And then if we look at these out through 5 weeks of age, these bull calves that were born in the later study, post LPS challenge, there's 1/4 of a pound improvement in average daily gain there with the LPS challenge. So are there lifelong impacts of receiving choline biomolecules in utero? So I showed this graph earlier. So this is the body weight during first lactation from this F1 generation, from that 2018 study that was published. So again, when these heifers calved in to their first lactation, they were significantly heavier at calving. This is milk yield in those same heifers. So this is first lactation milk yield out through 40 weeks in milk. Jimena, this looks a lot like some of your heat stress work in those dams. So this is that F1 generation again. So 2.2 kilo higher milk yield through during first lactation in these heifers that were exposed to choline in utero. So there's some more work being done there. That's not published data. Obviously, the p-value is not very high. We don't have a lot of animal numbers in there at this point, but that's being monitored in these later studies as well to see what kind of difference we're seeing there. And there's actually quite a bit of difference here if you look here right around peak, out here around 10 weeks of lactation. So what are some of the potential modes of action of choline that we're seeing here? Are we meeting a choline requirement for organ development and maturation? That's certainly one theory. So this is, Eric, this ties back to some of the work that you were showing. So if we take if we look at adequate intake here, so adequate choline intake in an adult female, 425 milligrams per day. During pregnancy, 450. During lactation, 550. What is the requirement during gestation for these cows? We don't know that exactly. We don't actually know the choline requirement. So phosphatidylcholine, Eric talked about this during his talk as well. Phosphatidylcholine is a key to the maturation of lungs in utero. So is that potentially playing a role here in improved calf health and performance? That may be a possibility. If you look at the composition of the surfactant in lungs, in lung tissue and intestinal tissue, It's very high in phospholipid content, and particularly phosphatidylcholine. Of course, the second possibility is improved expression of key genes responsible for growth, health, and immunity due to greater methylation of DNA in utero. So really tying in with what some of the previous speakers have talked about today.